Depression is a common medical disorder that affects feelings, thinking, and behavior. The World Health Organization said that depression is one of the leading causes of disability worldwide. More than 300 million people of all ages suffer from depression, and the number is increasing every day and everywhere. Depression is more than just a bout of sadness. All of us go through periods of sadness and frustration. But when do I say that I have depression? If you were sad or distressed for at least 2 weeks, with loss of interest in the things you love and enjoy, in this case, the diagnosis is depression. When an MRI was done on the brains of people with depression, they found that the parts of the brain responsible for mood, sleeping, appetite, and behavior were working abnormally, which proves that depression is a real disease that affects the brain. What are the causes of depression? And why there are people become depressed from the slightest thing happen to them, and sometimes really out of nothing, and other people, no matter what problems they face, they don't get the disorder. Firstly, genes play a very big role in the formation of the personality which is susceptible to depression. Scientists have found that there are entire families in which depression is widespread, which proves that genes play a very big role in getting the disorder. The second reason is the environment or the circumstances which the person is exposed to. If the circumstances were difficult, but the person has a genetic predisposition for depression, then the possibility of getting it is high. If the person doesn't have a genetic predisposition, then there is a possibility that the person will get depression, but the probability is not high. Depression may come out of blue, or after a personal loss such as the death of a loved one, divorce, financial problems, or family problems, or any difficult situation a person cannot cope with and adapt to. Depression doesn't only come in the form of persistent sadness, but there are other symptoms also indicated, such as loss of interest or pleasure in activities once enjoyed, which is a key symptom in diagnosing the disorder, and anxiety, feeling very bored, feeling of hopelessness or pessimism, feeling worthless, feeling that life has no purpose or meaning, easily fatigued, feeling lazy most of the time, difficulty concentrating and forgetfulness, trouble sleeping or oversleeping, changes in appetite such as weight loss or weight gain, constant headache or chronic pain that has no physical cause, thoughts of death and suicide. Depression, even in the most severe cases, is a highly treatable disorder. The earlier treatment is started, the more effective it will be and the more likely it is to prevent a recurrence. Moderate and severe depression require medical intervention with medication, but mild depression can be treated without medication. But in all cases of depression, there is a very important and basic treatment, which is cognitive behavioral therapy. This treatment simply focuses on correcting the wrong way of thinking. The distorted thinking has a big role in the feeling of depression. Your views of the world and people determine the way you think, which greatly affects your feelings and your behavior. The idea of cognitive behavioral therapy is that there is a strong relationship between feelings, thinking, actions, and the body, which means that if you do any physical or social activity, it will improve your feelings and your thinking. Likewise, if you think positively, it will affect and improve your mood. It's important to identify what exactly the negative thoughts that affect your mood. Correct these thoughts and replace it with positive ones. The next video will be about distorted ways of thinking, which can cause anxiety and depression.